Thank you very much, Roa, for a very generous, most of which I don't really deserve. So I've been asked to talk about meaningful research, and unfortunately, I'm going to touch upon some of the classical definitions and touch upon some of the debates surrounding the word meaningful itself. So we all know that research is essentially to establish and develop new conclusions, creation of new knowledge, the ability to understand new methodologies, and the whole exercise is about creativity. It's not about duplication. It's not about doing the same thing that has been done previously. So it's about a new search. So this is what research is about. Now, we add another dimension to this research by introducing the term meaningful research, and I'll touch upon that and what are the controversies which are there with this terminology. So for young researchers like yourself and those who are entering into the arena of research, the question really is that I have all set myself to become a physician or a doctor or a surgeon. What is this research thing has come up in between? Now, I'll tell you personally, I mean, I've always been a clinician and I'm still a clinician. And at the moment, I'm waiting for my case to be under, and hopefully at 6 o'clock, I'll be operating again. But I end up doing some research, mostly clinical work. But it really helped me to expand my knowledge base. It helped me to keep myself updated on information. All these points that you see on the screen, I've been able to narrow my area of expertise. Because as you know, that even if you want to become a neurosurgeon or a urologist or a neurologist, you can't really do justice to each and every aspect of this specialty. So you have to narrow it down so that you start working on a focus, and it's only on that focus that you'll be able to reach people, you will be able to do problem solving and encourage curiosity, not only in your audience, but also in your own quest for knowledge. This is a interesting statement, and I'm sure most of you probably have read this before, but I must read it again, that one must attend in medical practice, not primarily to plausible theories, but to experience combined with reason. And I'm sure that those who don't know who said that would think this is a very contemporary statement. This is what modern medicine is about, that we don't work on theories and anecdotal evidence, but we work upon reasoning and science. So medicine is a branch of science. However, this was said not recently, but by somebody called Hippocrates. And this is over 2,500 years back. So have we really progressed from that time till now, when very recently, only in the later part of the last century, 1990s, that the term evidence-based medicine was coined. And we know that evidence-based medicine is about clinical expertise, best research evidence, and patient values. And these all three together, what we create and what we call is evidence-based practice. And this is the clinical pyramid in which the quality of evidence is assessed by the quality of work which was done. So systematic review of a randomized controlled trial is at the pinnacle of, and the expert opinion, like my opinion about doing something, is at the bottom of the pyramid. So essentially, evidence-based medicine, as is defined by David Sackett at McMaster, is a conscientious, explicit, and judicious use of current best practice in making clinical decision about the patient's care. Now, Roa asked me to talk about meaningful research. So that's all good about research. I mean, this is research, fine. You create a question, you do define your methodology, and then you do some research work, you find new answers or new explanations about things, you publish your work. But what is about this meaningful research? Now, if I look at the definition of meaningful, it gives you all those similes: significant, relevant, valid, worthwhile, purposeful, consequential, weighty, pithy. So all these are essentially what meaningful is. That if your research, your hard work is not significant and it is only used to publish a paper in a low quality journal, I think it is not worth the effort. It has to be relevant, it has to be important, it has to make an impact on what you do. Now, how would you assess that? Well, there are various metric-based research evaluations, which include citations. So if your work is cited by others, it has to be relevant, it has to be meaningful, it has to be high quality. If your I10 index or H index is high, meaning that what you have done was meaningful. The number of PhD students that are working with you, the amount of grant money that you have, and various other tools which are used by various institutions and countries, like the REF, which is the Research Excellence Framework. That's what we call in Britain. The VQR, which is an Italian version of the same thing, which essentially stands for Valutazione della Qualità della Ricerca, which essentially means evaluation of the quality of research that you do. Or the ERA, which is the Australian counterpart of it. Similarly, the universities essentially use the Time Higher Education Indices or the QS index that you know to evaluate your universities. All these are there, and these are the metric-based evaluations. It's pretty simple to do. You can go onto internet, find out what is the I10 or H index of any scientist, and you would know in a matter of seconds how he or she has done in this metric-based evaluation. Now, I'm going to challenge you a little bit on this concept, and then we'll take you through some of my own conundrums in understanding the value of meaningful research. Now, all this may be high, but if it is not impacting your patient's care or patient's overall evaluation, then it is not meaningful as a clinical scientist. I mean, obviously, if you're a basic scientist, it has different definitions and meaning. Similarly, if your research has very little impact on society, then again, it is not likely to be meaningful. I don't know how many of you have seen Black Mirror on the Netflix. It's a dystopian science fiction series from Britain. I mean, it was there since last 10 years. It often describes scenarios in the near future employing technology that is already available or soon might be available. Now, this creates a dystopian world, and I'll take you through some of the next few slides to show that some of the matrices that we use are really very dystopian. So somebody said that study life as it is now in our times through the speculative lens of changing technology is what it's all about. This process of conducting and reposting research would be entirely gamified. So as researchers, are we sitting on computers and playing some dystopian game, creating a world which is unlikely to benefit from all our hard work? So we need to see whether we are overplaying these metric-based evaluation systems and they're not taking over the quality and meaningfulness of from our research. Now, there are certain hidden dangers in accepting these indicators. Although they are very convenient, just a few clicks of button and you will know exactly where you stand objectively. However, over-reliance on these indicators may end up making it more difficult to introduce a change for better. So I think these are some of the concepts that you probably need to understand before we find a definition of meaningful research. Somebody said that research excellence tells us nothing about how important the science is and everything about who decides. So we know about those institutions, we know about those departments which creates those models to define excellence in research. Okay, so this is a bit of a concept that you need to really struggle. However, in the broader definition of meaningful research, we need to understand that whatever we do has to be comprehensible, it should be relevant, and it should be valid, and it contributes to the intellectual framework of our sphere of work. So meaningful research has to be worthwhile. It may or may not score highly on your citation index, but if it is worthwhile, if it is making a difference, in my opinion, it is more relevant and meaningful than a highly cited article. Remember that we have evolved over decades, millennia in fact, from the time of Hippocrates 2,500 years back to now, and each and every, I think there's some audio, somebody's audio open. Anyhow, so the research often unfolds over time, which essentially means that you're making a little contribution in terms of a small block, and this small block will build up into a building. So it's not important that your bit and contribution in research essentially should be the final word, but it becomes a little element to develop into a whole story. In more simplified version of what am I talking about is that in order to do a meaningful research, the first step is to develop a research question. And I think young researchers, and in fact every researchers, find it most difficult to formulate a precise question that is answerable. Now, the second question that you will ask yourself is that the answer to the question, is it important to pursue? If the answer to your question is worth pursuing, then you should continue doing research. The next question that you ask yourself when you're starting a new project is, does the answer add to the present knowledge base? Well, if it adds to the new knowledge base, to the current knowledge base, again, it's worth pursuing. Does it simply confirm a previous observation? Sometimes it is important that you reconfirm the findings of another researcher. So it's not really novel, but it is a reconfirmation, and it is, again, important. You may be describing it better than what description has been provided previously. So how would you develop a good research question? You need to be novel. You need to preferably based upon new technologies, but these new technologies should have some past. It can lead to new directions, so it has a future, and it is important to current concerns, so it has a present. So whatever you do, it is in the context of the time that you are living in, but it is for the times to come. And as I've said, that it is often a very small building block for the whole story to unfold. How do you get an idea? And I think that's the most difficult thing to do, is to get a research idea. Sometimes You're lucky, you're standing under a tree and it falls on your head and you get an idea. Sometimes you have to refresh your ideas. And some of the institutions basically ask their researchers to take a bath, because sometimes you can get an idea while taking a bath. So the famous Archimedes principle. Well, you may look at a problem from different angles. I mean, so yes, it is a Mercedes, an old-fashioned Mercedes, but you can look at it from various different angles, and it may give you a totally new, fresh way of researching. Sometimes the most important thing is to be innovative, and this is my favorite video clip about innovation. So really, innovation is the key to your. Now, moving back to our research question, and I would describe this in 5 steps. Number 1 is to choose a subject that you're genuinely curious about, because it is a lot of hard work. So if there is something that is not of your interest, please do not enter into that area. I'm sorry about this phone call. Let me disconnect it. Okay, sorry. So it's important that you should research on areas which are your real interest. Carry out some preliminary research, focus on precise issues within the broader topic. Create an interesting research question. And this we have talked about a little bit. This question has to be original. I mean, you may get ideas from your research, literature search, but it has to be really something which has not been reported. So you have to look at it from a different angle. It should be focused. It should be complex enough so that someone else would not start working on it. And by the time you finish, it is already reported. It should be achievable. Obviously, you need to see where you're working, what your resource constraints are, what kind of funding is available. So would you be able to conduct that research and be able to complete the task? So that's important, that it should be achievable. Now, when you write your proposal, each and every word count. So it's important that when you send your proposal for research, you need to really write it precisely so that your funder or granting agency would approve of your proposal. And some of the simplified ways is the Pico, the PO model. And I'm sure that most of you know what Pico is. The population patient problem, intervention, comparison, and outcome. So this is a simple model on which you can base your research. So in an older man with a low back pain, is manual therapy more effective than drug therapy in relieving pain? Is a research question. So the P is the characteristic of the patient and the problem. Older men with the back problem, low back ache. What intervention? The intervention is that the manual therapy, the comparison is with the conventional treatment, which is the drug therapy, and what outcomes are you looking at is pain relief. Okay, so the research question is fragmented through the Pico model into very simplified way of assessing your, and this will explain how would you define your methodology for research. If you do not have a comparison group, you can use a PO model in which there is no comparison between groups. So the research process, in essence, is a research question, literature search, study design, measurements, data analysis, interpretation, conclusion, and then the cycle starts again. So you move from one research question, and while you're doing research, you may come up with another question, and so on. So idea, develop, fund, plan, do the research, complete the process, publish, read, and then the whole cycle starts again and again. And this is how you become an academic surgeon or academic physician. Remember, do something which is worth a while, and that's what meaningful research is. I find that there's a lot of work being published and reported, and there are very few readers. So if all your effort goes into nobody reading it, nobody taking a note out of it, it's a waste of an exercise, right? And that's why the research has to be meaningful. If you look at this, there are thousands of articles contributed daily to biomedical journals. There are hundreds of papers published, research trials reported, etc. But most of them end up here, which is the bias and the confounding trash can. And this is where most of the research ends up. It's only very little which actually end up being meaningful and helpful to the community. So how would you know your research is meaningful? Well, you need to look at the research, who has funded. So if Coca-Cola has funded the research, obviously drinking Coke and its impact would not be taken nicely if it says that it is health, it provides you good health and hygiene. Similarly, where it is published. So if it is published in a reputable journal with a good independent peer review process, then again, that research is likely to be meaningful. Again, it's also important that what kind of work, I mean, it's a small cohort study, or it is a randomized controlled trial, or it is a meta-analysis or a systematic review of a randomized trial, which again is something that is at the highest pinnacle of our evidence-based medicine. I'm sorry. And how would you find flaws in that research? Myself, as a reviewer for over 20 journals, I find that by looking and critically analyzing those research papers, I've learned a lot in critically evaluating a paper. That whenever I read a paper in a biomedical journal, I'm able to look and find flaws in that research. And that's how I decide which research paper is important and meaningful for me to implement into my clinical practice. So in essence, purely metric-based indicator for evaluating research would lead, in my opinion, to a dystopian environment, and you would be really playing games in a close quarter a video game rather than actually contributing to the academic database. There are hidden dangers in accepting convenient matrices like the I-10 index and the citation and so on. When you over-rely on those indices, you actually give a lot of power to the institutions which control those indices rather than contribute something which is. So in essence, I don't want to confuse you further, but defining meaningful research is difficult. You need to look at in your own context, what is worthwhile, what is meaningful, what can contribute to the betterment of your patient care, or defining a better methodology, a better diagnostic tool, etc., whenever you do research. Thank you very much for your attention, and I'll be happy to take questions. I hope I am done.
Thank you very much.